clicking and to do an illness discussion. So, I have gastroparesis. Gastroparesis is a condition that literally is a delayed stomach emptying. The name actually means paralyzed stomach. Who is it treated by? A gastroenterologist. I'm probably saying that wrong, but you know, a GI doctor. How is it normally diagnosed? The golden standard to diagnose gastroparesis is an emptying study where you will eat either eggs or oatmeal with a small amount of a radioactive material so they can track it. You will track this for 4 hours. In a healthy patient, the average retention for
1 hour is 90%, 2 hours 60%, 4 hours 10%.
So if you're less than that, you probably have it. When you're an unhealthy patient, they classify at the 4th hour mark 10 to 15% as mild, 16 to 35% as moderate, and 35 and up severe. And the symptoms are nausea, vomiting, bloating, cramping, feeling overly full, blood sugar problems, weight loss, weight gain, and malnutrition. Who does it affect? About 4% of the populations have symptoms similar to gastroparesis.
Mostly women are diagnosed. That's about 80% of the people who have been diagnosed. And out of that 80%, 50 of them are diabetics with either type 1 or type 2.
With the average onset age of being early 30s. What are some of the treatment options? Diets to avoid foods like fibrous foods as well as raw vegetables and high-fat foods because they take longer to digest. Smaller meals throughout the day. Chewing your food very well or blenderized food. One of the things they suggest is if you don't handle solids well, you can actually eat baby food since it's already pureed. Blood sugar control, which again, that's a lot of diabetics who have this. You need to keep track. Supplements, vitamins, and minerals. So for me, I get B12 shots because that's the one I really have trouble with.
Nausea medications like Compazine, Phenergan, and Zofran. Mobility medicines called prokinetics. Commonly used are Reglan and Motilium.
Gastric electric stimulator, a GES, where a surgeon will place a battery-powered device that sends signals to the nerves that control your stomach, as well as feeding tubes. Normally people, if they have gastroparesis, can benefit from a draining tube, so it's not on their stomach. But doctors will do that as an absolute last resort. Then there is 3 different types: idiopathic, diabetic, and post-surgical. So with idiopathic, they don't really know the reason 100%. Diabetic is if you have diabetes, then you get gastroparesis. It's from that, and it's secondary to the diabetes, which would be the primary. And then post-surgical, a lot of people who have abdominal surgery can have a delayed stomach. And what are the causes? Some common causes are medications such as opioids and some antidepressants, damage to the vagus nerve, connective tissue diseases, so like for me, I have Ehlers danlos, diabetes, and a history of eating disorders. When you have an eating disorder, especially if you are restrictive, your stomach will shrink and not be able to eat as much, and you get nauseous faster. That's one of the conditions I have, and you know, I'm pretty happy. Mine's actually not that bad. It's pretty mild. I probably throw up 3 or 4 times a week max. It's not every time I eat like some people. My biggest concern with that is the nausea, and I take plenty of anti-nausea medications. I actually also do the scopolamine motion sickness patches because those help with the dysautonomia nausea as well as the just regular gastroparesis nausea. Please subscribe, guys.